Hi, I'm Dr. Adrian Preston, and I'm a cardiologist at Cardiovascular Specialist of Central Maryland. I specialize in non-invasive cardiology, women's heart health, and nuclear cardiology. Both men and women are at risk for coronary artery disease. Men tend to have coronary artery disease a little bit younger than women, but by age 65, the prevalence is equal in both. Other risk factors include hypertension, high cholesterol, smoking, a family history of early coronary artery disease, a sedentary lifestyle, and certainly obesity will go along with that, diabetes, non-coronary atherosclerotic disease, including abdominal aortic disease, renal artery stenosis, and carotid artery disease, and lastly, chronic renal failure. There are 7 things that we can do to really improve our heart health. And the American Heart Association has actually come up with a mantra and a program to support that called Life's Simple 7. And the things that we really ought to be focusing on is number 1, is moving. Movement is extremely important, and being active and exercising are so important. Number 2 is eating well, not eating a lot of junk food. Number 3 is losing weight. A lot of us are overweight or obese, and losing weight is part of living healthily. The other things we can do is control our blood pressure. That may take medications, but certainly we need to really work on that because that's a silent disease, and a lot of times we don't treat it as aggressively. Other things is controlling your cholesterol, absolutely, with your diet as well as sometimes medication. Stopping smoking is extremely important. Reducing your sugars, your blood sugar, is very important to reduce both the risk of diabetes and heart disease. And those are the simple 7 steps. Well, the most important thing that I tell my patients is to actually start, because that is absolutely the hardest thing. You don't have to go 100%. You can take baby steps and try to work on your lifestyles gradually. You don't have to quit all 20 cigarettes, but reduce it to 10 cigarettes per day will make a dramatic impact on your heart health in a positive way. Persevere. You've got to just keep at it. Even though you fail, you've got to get back on the bandwagon and keep on doing it, because the more you walk, the more you eat better, the more of a lifestyle and a habit that it becomes. Another important thing you should remember about changing your lifestyle is it doesn't have to cost money. Things like walking or running is free. Walking your dog is part of your routine 30-minute walk per day. Climbing stairs, trying to eat less salt, that can be very inexpensive, and in fact can probably help you by decreasing your fast food restaurant intake, and maybe cooking at home a little bit more can do a tremendous amount of help for you, your fat intake, and also your sodium intake, which will help your blood pressure. What I suggest for patients who have no symptoms but are worried about their heart health is you should definitely see a doctor every year at least, and you should really keep an eye on your blood pressure. It's one thing that's easy to do, and it's free, and it's something you can do outside of the doctor's office.